Or on the other side, they're designing something that is absolutely not clinically relevant. And the interesting case is when they can't convince people, so let's say the engineers that are designing the product, when they can't convince them why it's not clinically relevant, that's often when I would be called in. And in one case, we were designing a test, and it has a swab. And as we all know as clinicians, there are certain parts of the body that you want to use different types of swabs on. Bottom line is, without going too deep into this, it was the wrong swab design for the space that it was supposed to be sampling. It would have been incredibly uncomfortable and led to huge adverse event reporting. And I remember one of my chief medical officers called me in and said, "Hey, I need you on this call." And he detailed what it was. And I started laughing. I said, "Are you kidding me? It's a Q-tip versus a wire brush. The wire brush is not appropriate for all surfaces of a human body. The Q-tip usually is. So why is this hard?" They said they don't understand because a competitor, they say, is using the wire brush. I said, "There's no way. There's no way." So bottom line is, it took us, I thought it would be one conversation. They'd call me in because I know how to communicate with the team. I thought it'd be one conversation. It was a series of conversations over, I shit you not, 6 weeks to have the right swab put in because it wasn't clinically relevant. So the clinical relevance piece, all of us have when we come to industry, but we can't speak that language. And that's where the problems come in.